Hi, I'm Trish. I have seen a lot of questions on a lot of the Facebook groups, like the tummy tuck groups and that sort of thing, about drains. When people have their surgeries and they have drains, a lot of people are very, very concerned about, are the drains going to hurt when they come out? How does it feel when they come out? All this sort of, there's a lot of anxiety around it. And I thought that I had already made a video about this, but I've looked back through all my videos, and unless I've missed it, I haven't made one. I've spoken about drains a little bit in one of my tummy tuck videos, but people aren't going to find that if they go searching for, does it hurt to have drains removed? So I thought I'll make a video just all about drains. I've got a bit of experience with this. I think I've tallied up, I've had 10 drains over the years, including, like gallbladder surgery and caesareans, breast reduction surgery and my tummy tuck surgery. So I do know a little bit about this. And also, I'm having revision surgery on my boobs next week, and I may or may not need a drain or drains for that. So if I do, if I get brave enough when the nurse comes to actually remove the drains, and if it's okay with the nurse, I'll film it for you, but I can't guarantee that because I don't always actually have the balls to ask those sort of questions. So I will tell you straight up, no, it does not hurt to have drains removed. It feels weird, it's uncomfortable, it's pretty creepy, but it doesn't hurt. Now I'll qualify that by saying I have had drains hurt a couple of times, but I don't really consider that they hurt because it's not a bad hurt. Even when it hurts or it feels super funky, it doesn't hurt, and it's over so quickly that it just really doesn't matter. The only drain I've had that really hurt was when I had open gallbladder surgery, and I was cut, like from here to here. It was a very, very long, big cut. It was very major surgery that cut through muscle, everything. Now, when you have a normal drainage tube, they're very small. They've got a very small diameter. They're like, I was going to say like that, the end of that pen, but they're probably not even that big. They're probably more like, I don't know, maybe like that. That's my makeup, one of my makeup brushes. Probably not even that big. They're quite small. But the one I had when I had my gallbladder done was probably, it was massive. It was like really big. It was at least that big. At least, probably, maybe even bigger. It was like a freaking garden hose. The nurses could not believe what that surgeon put inside my body. They'd never seen anything like it. I have a feeling he just didn't like me because I was really, really fat. Or maybe that's why I needed a really super big fat drain, because maybe fat people put out more crap. I don't know. Anyway, when they came to take that drain out, that was the third drain I'd had removed. I'd had a couple of other drains with my 2 caesareans that I'd had. I was very anxious when I had those removed, so it made it quite a quite unpleasant experience for me. And at that stage, I was very young. I didn't even know that like surgical drains were a thing, so they were a very big surprise for me. But they were just, in hindsight, they were just a bit uncomfortable. They were just a bit weird, a bit creepy. But when they did my gallbladder drain, the really fat one, when they put a drain inside your body, they stitch it to, like where it comes out of your skin, they put a couple of stitches to hold it in place. Otherwise, it's just going to fall out. So when the nurses came to take that drain out, when they take it out, they put pressure over the area, like with the drain coming out, they put pressure over the area and they pull it firmly until it comes out. They don't sort of like yank on it like that. They put pressure and they get it and they pull it like in one long fluid motion till it's all out. But they're supposed to remove the stitches first, and they didn't. They just they just put their hand over it and just went to take it out. So of course that really hurt because it was still stitched to my body. So then they stopped. They removed the stitches and they pulled it out. Now, because that one was quite a big one coming out, I can't even say it hurt, but it felt very, very, very uncomfortable. But it's very, very unlikely for anyone who's watching this, who's having a tummy tuck or you know, big breast reduction, anything like that. It's very unlikely that they'll use a tube of that size. I had 4 drains with my breast reduction because it was a very big surgery. Again, they felt funky coming out, and I felt one. It went from way back here all the way around and up here, and I felt that. I felt it. It was like a worm coming out of my body. I felt it move all the way down and out, but it didn't hurt. That was just my phone falling down. Yeah, so they didn't hurt at all. Then when I had my tummy tuck done, I had 1 drain on one side, 2 drains on the other side, plus I had 2 pain buster drains, and they're just like, they're so fine. They're like nothing. Like really, they're the thinnest drains I've ever seen. One of them fell out all by itself, and I didn't even notice. The other one, when it came out, again, felt a bit funky, but it didn't hurt. Now the one of the drains, actually 2 of the drains coming out from my tummy tuck got stuck. And this is just something that can happen. And I'm telling you about it so that you know, this is like a worst case scenario. If it does get stuck, this is what happens. Because if they're in for a little while, mine were only in for about 3 or 4 days or something, but if they're in for a little while, they can, I think the muck inside can get congealed around it, and it sort of like makes it a little bit stuck like that. So when they're pulling it out, if they feel resistance, they have to, I think they have to stop, and then they give it to decide if it's going to actually be able to be removed, or if they're going to need to get like further assistance or something. I don't know what would happen in that situation because I haven't been in that situation. But if they feel that resistance, then they just give it like a little bit of a harder tug to get it past that little bump, and then the rest of it comes out. Now I had that happen with 2 drains, and it doesn't hurt. It feels weird because you feel that like extra pull, but it doesn't hurt. It's like it moves past that point and then it comes out. And also one was laying over my hip bone, and I know that because I felt it move over my hip bone, but again, it didn't hurt. I promise you, it didn't hurt. It definitely feels weird, definitely feels uncomfortable, but it doesn't hurt. What I do, because I have had that instance where they didn't remove the stitches before they took the drains out, when the nurses come, I tell them that I've had that experience, and I'll generally say something like, you know, oh, how many stitches did they put in that one? Because then, in my head, I'm bringing their attention to the fact that there's stitches in there in case they've, you know, just like had a great big brain fart and forgotten. So that's for me. It's not to remind them or anything. It's just to make me feel better. Yeah, so they take the stitches out, they remove the drain, and they put a little dressing over it, and you know, that's the end of it. Now the drains can be quite big. As I said, I had one that went all the way around there and up there, but they don't take long to take out, like a few seconds. What I do, I get the nurses to count me down. So I get them to count me down from, you know, like 3 or 5 or whatever, and as they're counting down, I take a nice big breath in, and then when they get down to 1, which is when they do the pull, I breathe out, and that helps me to relax, and it helps me to concentrate more on my breathing than what they're doing on my body. And by the time I've breathed out fully, the drain's out. Unless it gets, the ones that got a bit stuck, that took 2 breaths, because, you know, it was like the, you know, sort of breathing out, and it got stuck, and I took another breath in, and then they gave it a good yank, and it came out. So just try to relax. Don't get yourself all worked up about it. It might help you to feel better if you make sure that you have your painkillers probably about 20 minutes before they do the procedure. They're normally quite happy for you to do that. And you'll probably be on painkillers anyway if you've had the sort of surgery that requires drains. And honestly, that's it. Even when it hurts, it's not that bad, and it doesn't last forever. It's a really quick procedure, and you will feel so much better once those drains are out, because you don't have to carry them around with you everywhere you go. You're not going to have, like if you've had a tummy tuck or even a breast reduction and you've got to wear one of those really tight bras, you won't have the pressure where the drains are coming out. They won't be bent at like awkward angles. If you've had a catheter put in, that's, another less thing to carry around. And also, little tip for when you do need to carry the drains around, particularly if you've got a lot. Like when I had my tummy done, I had 3 drains, at one stage 3 drains, 2 pain busters and a catheter. And if you're trying to get up and go to the toilet, or even just walk around, sit out of bed or whatever, ask them for a pillowcase and just put all that shit in the pillowcase, and you can carry it around, and it makes life a lot easier. And that's it. I'm not going to talk about how long they leave drains in, because it's from what I've read, it varies so much. My drains are normally in for about 3 days, 3 or 4 days. Other people, drains are in for a day. Other people, I've heard of people having drains in for a month. So, but I think that's quite unusual. And I also won't talk about how little has to drain each day for however many consecutive days before they take the drains out, because again, that varies from surgeon to surgeon. So hope this has been helpful. If you've got drains and they're coming out, don't get too worked up about it, because you'll honestly, once it's done, you'll be so relieved. And it's not that bad.